presentation. And now we have Dr. Yuganki. She is going to present COVID associations in the eye. Mhm.
Good morning, everyone. Um, and I hope after living 2 years in COVID, we are all very well aware about the COVID manifestations of the eye. I would just like to touch on the topic. So, the prevalence of the ocular manifestations in patients of COVID 19 ranges from 2% to 32%. The variation in the prevalence is because the exact prevalence cannot be commented upon because of the varied presentation at different time intervals and in different phases of the disease. So, this is just a broad timeline of the different ophthalmic manifestations, which can be divided into the ocular symptoms presenting initially, that is before COVID-19 or within the first week of onset, that is the acute onset, 0 to 7 days. Symptoms presenting between the second to third week are classified as subacute, and those which present as a late sequelae of the infection are called as delayed symptoms. So this is just a broad timeline telling us that conjunctivitis, keratoconjunctivitis, and episcleritis, they can present as acute or subacute, whereas the retinal manifestations and the neuroretinal things can present in the acute form and continue to present as a delayed presentation, whereas when we see conditions like central retinal artery occlusion, they usually present in the second to third week and continue as a late sequelae. So the COVID manifestation in the eye can be classified, can affect all the structures from the eyelid till the optic nerve. So, if we talk about the ocular surface and the cornea, so this is just the basic signs and symptoms. Dryness, pain, discharge, redness, which are very common symptoms of MGD, are seen up to 24.1% of the patient. The patient can also present with foreign body sensation, photophobia, itchiness, which is usually seen in cases of conjunctivitis. And lid margin hyperemia, crusted eyelashes, meibomian orifices abnormality are also seen. Coming on to the conjunctivitis, which is one of the most common ophthalmic manifestation documented in COVID-19 patients. There are various case reports presenting different forms, the most common one being the follicular one and the hemorrhagic pseudomembrane. Uh, Also, there are few case reports mentioning that because of the corneal involvement, it was a keratoconjunctivitis. I would like to mention that there are few case reports saying that there were conjunctivitis in children, which was classified as multi-system inflammatory syndrome in children, and it is a condition resembling Kawasaki disease. So this is just a table showing that various presentations were reported by various authors from worldwide as conjunctivitis as the first symptom. Then coming on to the second presentation can be in the form of episcleritis and scleritis. There are three case reports. Otef et al. Reported that a 29-year-old male with unilateral episcleritis as an initial presenting symptom of COVID-19. Then there was another one in which a 31-year-old presented with a nodular episcleritis. And there were two case reports by Fez et al. Saying reporting anterior scleritis in patients with COVID-19. It was a delayed sequelae. Coming on to the posterior segment manifestations, my colleague has already stressed upon very nicely the various viral manifestation. I would just like to classify them. So there have been very few case reports which say that there were conditions like serpiginous choroiditis. Then majorly the COVID-19 symptoms were of the retinal vascular occlusion because of the uh, 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 coagulant state that is produced, and there were a lot of cardiovascular diseases also. So it majorly affects the arteries and the veins in the form of central retinal vein occlusion, central retinal artery occlusion, acute macular neuroretinitis, and paracentral acute macular middle maculopathy. Other retinal manifestations which have been reported in literature were in the form of acute retinal necrosis and vitritis and abnormalities of the outer retinal layers. Neuroophthalmic manifestations, there were very few case reports because these were in the patients who were hospitalized and with very severe COVID infections, but there are cases mentioning papillophlebitis, optic neuritis, AD stonic pupil, Miller-Fisher syndrome with cranial nerve palsies, third as well as sixth, neurogenic ptosis, and CVA with vision loss. And to just touch upon the orbital manifestations of COVID-19, mucormycosis, as we are all aware, has been a disaster in the COVID-19 era. Besides this, there have been reports of patient presenting with orbital cellulitis and acroadenitis, and few with a retroorbital vein. Thank you.